Okay, welcome to Renew Education. This is another case study. We've already done the upper. If you're interested in this case, the upper is more interesting than the bottom. And if you did watch the upper, my big message was, if you do the upper, you have to eliminate these teeth because of the combination syndrome problem you're going to face with restoring the upper and having this combination syndrome setup. So you have to make sure that this patient is on board to do the lower, which is just take those teeth out. So what is this patient here? Well, this patient's actually fairly green. So the patient has a green on most everything, but I would give the patient a yellow on detached gingiva and repeated bite. So having a repeatable bite is very important in the end game. But everything else, even if there's a lingual shelf on the lower posterior where it kind of comes from more of a constrictive point of view, the bone is good, all these things are good. So let's look at that. But this is a great case if you are new to doing all-on-4 models or doing anything where you're doing like 4 locators or doing full arch implant cases. So this is a really good case for those because he is a healthy patient and the bone looks excellent. So here, these teeth are pretty much gone, but let's look at the quality of the bone as we go along. And I'm going to go towards the posterior on the right side. And we're going to look at the nerve here. So the nerve is going here, so then it just kind of tracks back right here. And you have a lot of generous bone all through the posterior. You have your detached gingiva over here. And you have a little lingual shelf, but that's very wide. You know, you've got a lot of room here. So you've got 8 millimeters just right, 7.5 right there. So that should not stop you from position or anything like this. This is also a really good case to look at from a perspective of using a surgical guide. What a surgical guide could do in this case, if you made a surgical guide with the teeth in, the teeth become the anchor for the surgical guide. So that's pretty important to utilize these teeth. And now you have an anchor for how these teeth will hold the guide down. When you do a tooth-borne surgical guide, you end up with it slopping around the arch. But if you have tissue-borne, if you have a tooth-borne surgical guide, it stays very stable. And you would be looking at doing an implant, let's say here, you would want to do something back here. You would want to do it back here, and here. So that, changing my thing, let's see. You want to do something like that. So that would be a nice spread that you would do. You might even bring this more anterior because I'm probably in the canine area here, and you might want to bring that even a little more forward, and this is probably a little further back than necessary, but you get the idea. The promise of a 4-legged stool being solid would be really excellent, and you could make the guide where you take this tooth out and do an immediate placement or something like that. So this is a great guided case, surgical guided case. This is a great case if you didn't do a surgical guide. If you did not do a surgical guide, what I do, because I don't do a lot of surgical guides anymore, they do help you go faster. They do get the implants exactly where you want them. But what I do is I take a measurement from this root over to, let's say, the first implant. So I say, okay, from this tooth, before I take it out, I'll put the implant in here about 4.5 millimeters away. And I know I'm going to go in the line angle of this tooth. So I use these teeth as physical guides to get my implants in, because once you take this out, you lose your bearings. You lose the positioning that you would normally have when you have teeth there. Now, once I have that implant in, and now I know the center of that implant is about 4.5 millimeters, I'll then take another measurement and I'll say, well, I want it from center to center. I want it here 18.5 millimeters away. And then I measure that away. here's something that's pretty helpful. I haven't seen implant systems do it that much anymore, but try to get the implant systems to have a mount, or you can take an impression coping, and when you put an impression coping into that implant, now you can determine it like a tooth. So let's say we put an impression coping in here, and now we know the line angle of that implant. So if you're trying to make something more parallel, let's say to this implant here, you have an impression coping here that will allow you to then do your implant here in line with that impression coping. Back when we had implants that had mounts, I would leave the mount in, and then what you do is drill and you put a pin in, and then you look at how parallel you are to that implant. Same thing here. If you're going to do an implant over here, you're going to look at the line angle. You're going to put an implant in here, and then you would also then put that impression coping here. So now you're one step closer to putting in here, and now you get the line angle corrected for that. So these teeth are still valuable for placement of the implants for sure. It's more about how are you going to use them. Are you going to use a tooth-borne guide, or are you just going to use them like I would, where I would be measuring those implants out? That's about all I could say here. I wouldn't be doing any grafting in this case either. This will heal up just fine. Grafting won't benefit the patient at all here. And now I'm on this side, and you can see just how the bone starts to tweak a little bit. But the nerve is pretty far down, and that should be completely fine here. The load would be coming here, so he's got that facial plate is gone where the tooth once was, but he's got such wide bone and such really nice looking bone for an implant that this is definitely a winner. So that's the lower on this case. Take a look at the upper if you haven't seen it. Give us a like on Facebook, and subscribe if you haven't already to the YouTube channel, and check us out for some of our live streams on all these channels, including Twitch and Mixer. Great. Thanks very much.